fourth surge. It's very disappointing that we're here. I will be the first to say that I was naive enough to think that after vaccines were widely available, we would not be in this mode of kind of wearing masks again and dealing with constantly looking at these high numbers. Currently, the total cases for the parish as of yesterday's case count is 51,000 cases, 919 deaths. So certainly, as we always know, many, many people have suffered greatly from this terrible disease. What we're facing now in Jefferson Parish as well as the state, I'm sure, is that we're seeing the highest amount of cases. In Jefferson Parish, this is the highest amount of cases we've seen since January, when we were dealing with the aftermath of the holiday season and the Christmas season. So it's been 6 months since we've seen this very high level of cases coming in day after day. As the governor said on Friday, Louisiana has the highest per capita rate of growth of new cases in the United States. When we just look back 1 month ago in Jefferson Parish, we were averaging 20 cases a day with a 2% positivity rate. We were in a very, very good place. It was right around that same time that the Delta variant was identified in the region, about 1 month ago. So here we go 1 month later, and instead of 20 cases a day and a 2% positivity rate, we're at an average of 289 cases a day with an average of 14% positivity rate. So we're in a very, very different place. The vaccination rates in Jefferson Parish, approximately 53% of our population in the parish has initiated the vaccine. 48% of the population has completed the series. So in terms of comparison to other parishes, we're doing well in Jefferson Parish. We're one of the very top parishes. I think Orleans, West Feliciana, where it is, and I think we're ranked third. But that doesn't mean much in a state that trails the country, right? So we're doing well in a state that is doing very, very poorly, and we can do better. And I think if you look at our parish rates against other states in general, we're just below the midline. So in the parish, we're just about the midline to the rest of the country in the states that are kind of around the middle. When you recall when we talked about COVID, and some of our most vulnerable citizens were the elderly. So the good news, the very good news, is fortunately the higher up in age you go, the more vaccinated those people are. So you see a 70 to 80% vaccination rate at this for the 70 and 80-year-olds, generally speaking. So that's very, very good. But the new cases in our region we're seeing are cases under 30 years old for the new cases. So we're looking at very different scenarios than we were a year ago. I want to specifically talk about Jefferson Parish hotspots. I want to go into neighborhoods where we're seeing it just really hot, okay? Kenner in the Grand Lake Estates area, whole chunk of Metairie, David Drive, West Esplanade, Causeway, and West Napoleon, that border, which is a big chunk of Metairie. Terrytown and the Marrero and Woodmere neighborhoods, very hot spots. There is a correlation, if you look at the data. These are also areas with low vaccination rates. So the hot spots we're seeing in Jefferson Parish are also some of our lowest vaccination rates. I'm going to make a personal appeal to any of you all who have not yet had the vaccine, and I'm going to simply ask that you reconsider. Those of us who have been working on the front lines of this issue, you know, I know I'm tired, our team's tired, we're all emotionally, physically, mentally exhausted about talking about this issue. I can't, as tired as I am, I can't imagine what these gentlemen behind me and the folks in our medical community are going through. All any of us ever wanted, all of our intentions, whether it was controversial or not, was to reduce the impact of this terrible disease in our community from a transmission, from a case perspective, and certainly from a death rate perspective. So all we can do is ask you again, if you have not been vaccinated, to reconsider. Situations change in life. What might have been the right decision for you earlier, understand that situations change. If you were someone who thought, well, I don't have to get vaccinated, our numbers are low, this thing's going away, I'm here, and the people here standing at the podium with me are saying that is not the situation we're in. That did not happen. So you got to regroup in your mind, and maybe it's time to reconsider, and that's my ask of you. If you were someone who was hesitant about a lack of information, the vaccines have been out 7 months. You know people who have been vaccinated. Please ask those questions, get informed, get to where your comfort level is to perhaps reconsider. And if you were someone who it wasn't convenient for you to take the time to get vaccinated, all I can say now is the time to make the time, because this thing is very real and this surge is upon us. So we want to remind everyone that Louisiana Department of Health now recommends that all individuals, regardless of vaccination status, mask indoors and get tested if they suspect they've been exposed. Obviously, the more this virus spreads, and we cannot put this to bed, the more opportunity we're giving it to alter and mutate, and that's what we're seeing, and the vaccines maybe to not be effective one day, which is very scary personally for me as well, because myself and my family have all been vaccinated, and I certainly don't want to, I have a sense of relief getting vaccinated, and I don't want to go back to where I felt, a year ago. So due to the high rate of COVID in our community right now, I'm announcing that we're ramping up our testing and our vaccination and putting more resources to this effort. We're very, very proud of the fact that last March of 2020, Jefferson Parish was one of the very first parishes to bring free testing through a federal pilot program. And we have consistently had free testing in Jefferson Parish this entire time. I want to thank the Louisiana National Guard. Joe Valianti tells me he thinks we're one of the only areas in the entire state that has had consistent free testing, right, from this program. So we have maintained that. But when COVID was high, Jefferson Parish government also got involved to help our medical community with testing and vaccines. We've put more resources to that when COVID was high. We dropped off on that in March, focused our efforts and our community-based resources to the vaccination efforts. We're now re-engaging community-based testing, which is, again, we have always had Ilario, and I'll tell you that location's moved, that's been steady. We've also popped up, for lack of a better word, pop-up sites, and we're re-engaging those partners to bring more pop-up testing sites to you because of this increase in the demand and because we are in this fourth surge. So what was always Ilario, please everybody know, we moved that site several weeks ago. So the free testing that was once Ilario was at Harold McDonald Park, 900 Drake Avenue in Westwego, virtually across the West Bank Expressway from Ilario Center in a few blocks difference. Okay, so testing at this location has been available Monday through Friday, 8 to 4. We're increasing it to Saturdays again, 8 to 2. Okay, so Monday through Friday, 8 to 4, Saturdays from 8 to 2. We're going to have the Pfizer and the J&J vaccinations available at this site. And again, we want to thank the Louisiana National Guard. These men and women have been supporting this site from the very, very beginning, many of them away from their families for a long time, so we want to thank them for their partnership. We're also working with our healthcare partners to increase vaccination and testing, and we're going to have a site that actually has vaccination and testing at the same site on both sides of the parish. So just want to remind you, go back, vaccinations are at the airport every day at the baggage claim doors, 8:30 to 5. Vaccinations at Lakeside Shopping Center every day from 11 to 6:30. These are Ochsner sites. Now we're partnering with Ochsner for, again, the community base that we're re-engaging. It's going to be a walk-up vaccination and testing site, Little Farms in River Ridge with Ochsner this Thursday from 9 to 3. We're going to have another walk-up and vaccination testing site at Celebration Church in Kenner. Ochsner partnering again with us Monday, August 2nd and Tuesday, August 3rd from 9 to 1. And then LCMC has started again their drive-through testing center at West Jefferson Medical Center Monday through Friday, 10 to 5 p.m. So all of these are new resources that we're bringing to our citizens because of this new surge that we're in. And certainly check our website for the full list of the testing and vaccination sites so you can get those on your schedule if need be. We want to remind everyone that Jefferson Parish also will bring the vaccination to you and come vaccinate you at your home if you cannot get to a site, if you have mobility issues and you cannot get to a site. We've done this for 256 people so far. That number is 504-518-4020. And again, if you're someone that wants more information about this vaccine or just have technical issues that you have to square away in your mind, please call the LDH hotline at 453-0774. So I am going to bring up the next speaker, who is, this is a gentleman who's worked so very hard in our country and in other countries as well, fighting this disease. Dr. Evans Laborde, again, the Medical Director for Global Health Education and Public Health for Ochsner.
Good morning, and thank you, Vice President Cynthia Lee Sheng. She said, I'm Dr. Evans Laborde, and really have been involved with this fight from the very beginning with the parish president and her excellent team here at Jefferson Parish from the very beginning of the pandemic. And of course, after months of meeting people where they are and breaking down barriers with her and her excellent team in partnership to deliver the vaccine, as she stated, equitably and quickly, to our communities in need. Unfortunately, as she stated, we're currently experiencing our fourth surge of COVID-19. We've been here, unfortunately, 3 times before, but I think this time there's some fundamental differences. I think we know a lot more. We understand the power of social distancing, of masking, and the importance of those other mitigating factors. But more importantly, we have really, through the incredible achievement of science, one of the most incredible and powerful tools available to us at this present time, and that is 3 very safe and effective vaccines that, if appropriately used, would actually have made this current situation that we're in to a certain degree preventable. And as you know, the pattern, as the parish president recently alluded to, the governor stated, unfortunately, we have the dubious distinction at this point in time of being the state with the highest growth rate per capita of COVID infections in the nation. This is somewhat distressing because we've all worked so hard to ensure that we weren't in that particular position. But what that actually entails, as our colleagues know, the pattern is quite clear. Initially, you have this increase in community spread, and that's driven by the fact that the Delta virus is so much more transmissible and infectious than the previous strain. And so this increase in community spread leads to a familiar pattern. It leads to increased sickness and then subsequently hospitalization and putting an additional stress on our healthcare system. And that's the pattern, unfortunately, that we've seen before, that is actually repeating itself at this present time. Just to kind of give you an example, at our hospital at Ochsner, on June 30th, a little more than a few weeks ago, 3 weeks ago, we actually had 68 patients that were inpatients in the hospital at that time across our entire system who had COVID at that particular time. And then fast forward that to just a few weeks, we've actually seen an increase of over 423% in our inpatient volume of patients at the hospital throughout our system. So from that small number, relatively, of 68 COVID-19 inpatients, to right now, we're about 474 system-wide. So you can imagine that's a really significant, as I said, almost 500% increase in the number of inpatients that we have in the hospital. And what this does, as we all know, it puts an additional stress and pressure on an already pressured system, healthcare system, not only at Ochsner, but LCMC and all our partner facilities. And so again, what makes this variant, as the parish president alluded to, significantly more problematic and troublesome is the degree of transmissibility. And so what's happening right now, and what people need to understand, that this is first and foremost an epidemic, a pandemic of the unvaccinated. And so what we're seeing currently at our hospital is that 95% of the inpatient, of those numbers that we alluded to, are people who for whatever reason, have not been vaccinated. They're the people who are getting admitted. And that's not only for true of us here, but that's true, nationwide. And so what this actually tells us is that this is very much a predictable and absolutely a preventable disease, and the situation that we're at right now is one that, as dire as it may be, is somewhat hopeful because we have a powerful tool at our disposal to address that. And so, again, I would reiterate that from Oxford's perspective, the partnership that we've had with the parish president, with her team, with LCMC, with the state, locally has been really outstanding, and we remain unwavering in our commitment to administer the vaccines as quickly and as equitably as possible here in Jefferson Parish. We're willing, as she said, as the parish president said, to use all the means and measures that are available to go to whatever places that need, that individuals need to be tested, to remove the traditional barriers. We've been doing that really since the very onset. As she stated, we have partnerships at the airport. We have a site at Lakeside. We recently started a site at Oakwood, and all of those are testimony of the fact that how dedicated we are to getting this done. I guess I'd like to end, though, on a positive note, as dire as all this may be. Again, kind of reiterate that this is really an issue of the unvaccinated. We have very safe and effective vaccines that we here in Louisiana have studied, have researched, and have administered safely, efficiently, and effectively to protect our communities. The positive note that I'd like to end on is that, in essence, although we have this increased growth rate of positivity compared to the rest of the nation, from July 12th to the 19th, we saw 30,000, about 250 people get their first doses. I think the recognition of how serious this is, a week later last week, from July 19th to the 26th, we actually saw almost a 95% increase in the vaccination rate from 1 week to the next, meaning that we actually had 58,861 patients actually roll up their sleeves and get their first dose. So I would end by, the second number was 58,861. So again, that's about 95% increase in the number of people getting their first doses. So again, I'd like to end by recognizing all the partners that we have here and all the work that's being done in the community, and realizing to thank also the 3.4 million individuals who in Louisiana, don't forget, who've gotten their first doses. Really want to recognize and thank them and encourage them to be ambassadors, to spread the message, to let their friends and their family know that they've been vaccinated and that they're well and that they're contributing to what we actually want is a healthy, vibrant state. And we cannot get to that until we have a fully and equitably vaccinated state. So I just want to thank the parish president and the entire team as well for their consistent and tireless effort in getting us to that point. Thank you.
Great. Thank you so much, Dr. Laborde. Our next speaker will be Dr. Jeffrey Elder, the Medical Director of Emergency Management for LCMC Health.
Thank you, Madam President. So I'd like to start to echo what Dr. Laborde was saying, and just to say that, this really is a pandemic now of the unvaccinated. 90+% of our hospital admissions are just unvaccinated individuals. And, it's unfortunate, over the past 2 weeks as I work in the emergency department, I've had to sit down with patients and tell them, while they're on oxygen, that they're positive for COVID. And I've had more than one patient, get very upset and just say, I had the chance and I didn't get vaccinated. And that is really heartbreaking to see, because we know we're now admitting people to the hospital with critical illness that could have been prevented by vaccination. A little bit more about what we're seeing in the community. Just yesterday, LCMC Health opened up a drive-through clinic for testing at West Jefferson Medical Center. Our positivity rate there was 33% yesterday. And so that is a huge number. It is a number we have not seen in a long time. And so that means there is a lot of virus in the community that is spreading. And unfortunately, when we've talked to some people that have tested positive, they're surprised. But we really should not be surprised now. If you are unvaccinated, you're at high risk to test positive and to catch coronavirus. And we want to stop this in its tracks. Our hospital capacity is stressed across the state. For our system, last month we had times where we had single-digit patients with COVID in the hospitals. Now we're over 110 in our region for LCMC Health. Again, 90+% of those patients unvaccinated. Our emergency departments across the region and across the state are full. Our hospitals are full. LCMC Health, along with other health systems yesterday, started to announce that we are cutting back on some of our non-time sensitive illness and surgeries that would require an admission. And so I think that's important for people to know. We have not done this since the beginning of the pandemic in March and April of 2020, and that's because of capacity issues. We want to make sure we have the staff to care for some of these critically ill patients that are coming in with COVID and other problems. And unfortunately, that means for others, they won't be able to have some of their procedures at the time that they were originally scheduled. And this is all due to the stress that's on all of our hospitals across the state. And so I just want to end by reminding everybody that, we're only at the beginning of this surge. There are two ways we can stop this. Number one, we can get people vaccinated. And if you haven't been vaccinated, now is the time. And number two, now is the time where we have to mask again. It was nice that we didn't have to do it for a while because the virus circulating in our community was so low. But now for both vaccinated and unvaccinated individuals, in order to decrease spread, we want to see more people masked when they're indoors around others, regardless of vaccination status. And so with that, if we can ask the community to do those simple things, I think we can really push harder to suppress this, keep our numbers low in the hospital, and get through this surge. So, thank you.
Obviously, we're always concerned about the very serious cases and the hospitalization, and of course, the death rates that can follow. So with that, Dr. Jerry Stephanovich is our coroner to discuss that issue.
Good morning. There's lots of conversations about this, obviously. Some of those start in the media, a lot of them on social media, and a lot of them just between individuals. And one thing I would like to encourage everybody is, the tone of those conversations, yelling at people, talking down to people, shaming people, really is a difficult way to get people to do what you want them to do. And so, for example, with Delta, Delta is not the fault of the unvaccinated, but that said, it's here, and we all have to deal with it, whether we're vaccinated or unvaccinated. It came from the outside. And, I think we're a very smart parish. And, what I'd like to do is just, talk to, some statistics and my own analysis and, and hope that people make a decision, based on those facts. Talking about deaths from the coronavirus. And, I get no gain out of changing a death. Last year we had over 600 deaths from coronavirus. Not with, everybody's with. These are from coronavirus. They may have had other medical conditions, but died due to coronavirus. This year, thankfully with that last spike we had that ended a few months ago, our healthcare system has gotten a lot better at treating people. They know how to turn people, how to maybe sometimes not put them on ventilators. They've got therapeutics that have been very helpful. Okay, so and then we've had the vaccination. So our death rate actually went down pretty significantly. After 600 deaths in a little bit more than a half a year last year, we had 96 in January because we were still in that spike. We had 48, then 15, then 10, and actually in May we were down to 3 deaths. So we were doing great. It's peaked up. It started, we had a few more in June, 6. In July, we've only had, with all due respect to the people that died and their families, we've had 9 deaths so far this month, but the majority of them are in the last week. So I expect that number to go up. That is, that's just a fact. And I'll also add, there have been some deaths in the unvaccinated people. And a lot of people take that and twist that and try to make some analysis out of that. You know, that said, the overwhelming majority of the deaths, as well as the positive cases and the hospitalizations, are all in folks who haven't been vaccinated. That's another fact, okay? These breakthrough cases, okay, as I call it, meaning somebody who's been vaccinated, but they still turned up having COVID. It's not unexpected, okay? It's actually similar to the flu vaccine, and I think a lot of people will remember, many of us get a seasonal flu shot. And a lot of times you get your flu shot, and then there's a strain of the flu, and people still get the flu. But invariably, those people who still get the flu don't get as sick, and it doesn't last as long. Doesn't guarantee that they won't get horribly sick or die, but it's very unlikely. That's exactly what's going on with the COVID vaccine in these breakthrough cases. So, you know, it's not unexpected. For example, you know, just to remind you, on average, 35,000 people a year die from the seasonal flu. Okay, this flu, this COVID, is just a lot worse. Okay, and we didn't have a vaccine. So, you know, as before, you know, folks with comorbidities are at the most risk. So if you or a loved one has, for example, diabetes, high blood pressure, obesity, kidney disease, anything that makes you immunocompromised, you're at more risk. You should be more careful right now. Okay. And you know, when vaccines came out, you know, and became available to the general public, you guys remember it was in kind of April, May when they started making it available for anybody who wanted it. Well, that coincided with our number of cases going way down. So a lot of people applied a reasonable logic, you know, even though I didn't agree with it, to say, hey, you know, the COVID's gone now, I'm not getting a vaccine. So I think that there's a lot of people out there who are going to take the facts that we've discussed already today by my colleagues and President Sheng and make a decision that I hope gets them vaccinated and make the right choice. You know, it's a different point now. You know, our healthcare system is busting at the seams. They're overwhelmed. And, you know, last year, when we were in the middle of COVID, there was a big wave nationally of people acknowledging the folks doing a hard job. And you know, to be honest, I haven't seen it yet this time. Not that these people need the accolades. They love what they do. But it doesn't matter if somebody's in EMS, an inpatient unit, ER, urgent care. Trust me, they're getting crushed right now. So if you know somebody that works in healthcare, front line, you know, please reach out to them and thank them for their hard work. Thank you very much.
Thank you so much, Dr. Stephanovich, and thank you for what you do. One of the silver linings of this COVID and having to work this issue since for about a year and a half is that we have strengthened relationships in ways that maybe we would not have had before, certainly with our medical community and also with our educational partners. So with that, I would like to introduce Dr. James Gray, our superintendent of Jefferson Parish School System.
Thank you, Madam President. It's no secret that last year was a challenging year for all of us. The plus is last year we did not have a vaccination available. This year we have one available. And so in order for us to be able to make it through last year, it took the collaboration of civic leaders, parish government, healthcare professionals, business and industry. Everybody wanted to try to give us the best chance for us to provide in-person learning for all of our kids last school year. Since August, since about 2 weeks now, our principals have been back in school. And what we're trying to do is make sure that we provide a very safe and orderly environment for our kids when they return on August 9th. But at the same time, too, we want to make sure that we're prepared to deal with them both instructionally, emotionally, and socially. In order for us to be able to continue to do the work that we've done last year, we have to continue the partnerships that we had and build upon that to make sure that we provide as many vaccination opportunities moving forward. So in order for us to be able to do that, we had to make sure that our parents were well informed last year. We had to make sure that every time we had an opportunity to provide a vaccination event when they were available, we provided that vaccination event. now that we have students that are available, we're providing vaccination opportunities for them as well. Just last week, we had three vaccination events. We had a total of about approximately 350 people that were vaccinated. About roughly 60% of those were students. So that's really a silver lining right now, the fact that we're getting more people involved in the vaccination process. When we first started this and children were first eligible, we were getting very, very low numbers. So the fact that we actually have an increased number of students participating is really a good point for us to kind of build upon. We want to make sure that we provide as many vaccination opportunities moving forward. We're having a second event on August 6th with Inclusive Care and Children's to provide a second round, but we also want to make sure we continuously partner with our providers and with the parish government to provide as many opportunities as we possibly can. I think the part that I want to kind of hammer home the most is the fact that, you know, we still have not put out our guidance for this school year yet. We'll be doing so by the end of the week. But the reason why we've delayed at this particular point is because the data is constantly rolling in and the contexts are shifting daily. We're in constant communication with all our healthcare providers, and we want to make sure that we're making a smart, informed decision when we put our guidance out. So we want to make sure that we've communicated with our parents last week to let them know where we were, but we also want to make sure that we let them know that we'll be coming out with our communication this particular week. I think I want to close with saying that when testing opportunities came about, we made sure we provide those testing opportunities for our teachers. Vaccination opportunities came about, we want to make sure that we provided as many vaccination opportunities. All of the people on this stage talked about the importance of the vaccination, so it's almost not much that I can add to this particular conversation. But for me personally, the more we provide safer opportunities and have this as another mitigation step for us to be able to stay in-person learning for this upcoming school year, I think the better it's going to be for all people involved. Whether it provides opportunity for our kids to have a safe, nurturing learning environment to where they can be connected to their teachers and to their peers, but also give parents an opportunity to understand that we're providing the best possible place for their students to learn. So with that, I want to say thank you all for the support that you've given me and our district, and hopefully you continue to give the same support. Thank you.
I'm sorry, can I make one more? You know, while we're on the topic of education, our children, I just want to say I've got 4 kids, 20, 18, 16, and 14. All 4 of my kids are vaccinated. I researched it. I looked at the pluses and minuses. I made that decision. I respect everybody else's decision, but I just want to share my personal, is that I vaccinated my own kids. Thank you.
Thank you, Dr. Stephanovich. Okay. Does anybody have any questions for us? Yeah, Paul?
Madam President, you were saying that the test positive rate now is 14% in Jefferson Parish. As you remember, earlier in the year, there were certain benchmarks that allowed the opening of gathering limits and the opening of bars and whatnot. I think the threshold was 5%. If this persists, do you see returning to gathering limits and returning to the mitigation measures in bars?
So, Paul, I'll tell you, you know, Jefferson Parish, we've always stayed with the state. New Orleans has a medical health unit and a medical department. We do not. So I don't get the data. I don't have any medical professionals on my staff. So Jefferson Parish's medical unit is the Louisiana Department of Health. So we have always followed with those state guidelines. And I don't know, I know the governor has a press conference later this week. I don't know, you know, what he plans on saying, or I'm sure he's looking at the data in his team to see what's coming down.
Is that something you think in your mind that we need to do until this surge subsides?
You know, I don't know where the state's going out. Personally, I'll tell you in my mind, and I have to be frank, I might be criticized for this. I believed in all of the very, for lack of a better word, draconian shutdowns we had last year. As hard as it was, I think I lost sleep over it, but I knew that life was more important. And I also knew that putting food on the table for your family was also very important. So, but I believed in it because, you know, we wanted to keep everybody alive. And that was because we were waiting for the vaccine to be developed. We were waiting for what company and how many companies were. and what we were going to take. And that's all, that's the discussion. We had to do these very extreme measures until the cure is out there. The cure is out there in many different ways. We're making it as convenient to you to get it. We're even coming to your home. We're coming to your churches, to your grocery stores. It's free. So from a public policy perspective, I have to admit that I don't feel the same way, because I think the situation has drastically changed. Even though we're in another surge, we've been in this surge 3 times before, to me, this surge is different, and I have to say there's an element of self-responsibility to it. That now, when you make your own choices, you know, you assess that risk yourself. And so, in my mind, we're in a different place, just from a public policy perspective. But I don't know what the governor plans. Obviously, I'm sure his team, everybody is just trying to reduce the transmission rate, keep the deaths down. So we will follow whatever the state does. Yes.
Some cities like New York City have required that all city employees either get vaccinated or do a negative test each week. Is that something that Jefferson Parish would ever consider, measures like that for city employees?
We're looking at that from a legal perspective. I'm not, you know, I think there's a question probably on a lot of organizations, because, you know, prior to this COVID, you know, your medical information was very private and should be private. But, you know, having said that, I certainly don't want to we provide, you know, especially for the government, we provide critical services to our citizens, whether it's, you know, your water, your sewer, you know, emergency response. So I have an obligation to make sure these operations stay running. And if we're going to start having to shut down whole departments because of people being quarantined, and I find out, you know, it's because, you know, I don't know if an employee is masked and unvaccinated, you know, but if we start really getting to where I can't deliver operations to our citizens and to our taxpayers, we're going to have to start looking at that kind of stuff. But we're not looking at that at the moment because we're still operating. But it butts up against a personal privacy issue versus our you know, responsibility to provide essential services to the community. And it is my responsibility to keep these departments running. We don't need to have more problems on our hands. Yeah. Yeah, we're gonna push out. Obviously, we're trying to, you know, the first step is getting the information out there to say this is a hotspot. You are living in a hotspot area. Obviously, that has some meaning, but you know, you go out of your hotspot to go to work. You might go out of your hotspot to socialize, but we're constantly looking at that. When I, for lack of a better word, when we looked at community-based testing and vaccines and those kind of things, we would always look at the data to determine, you know, where we want to go, and we're going to continue to do that. Yes. Mm-hmm.
Superintendent, so the CDC is expected to roll out new guidance on mask wearing. Is that something that you guys are going to do for students and require that, or have y'all made a decision at this point?
One of the things that we talked about, or continuously talking about, what our requirement is going to be for masks. So that's something that will be in our guidance when we put it out on Thursday. But we're constantly having the conversations with all of our healthcare providers, looking at the guidance coming down from the CDC, the guidance from the governor, and from LDOE, and then we're going to make an informed decision. But that will be in our guidance coming up this week.
Question to one of the doctors. Reading in some places that have experienced this fourth surge before we did, and the research indicated that this isn't a prolonged surge. And I think one of the numbers that was given was in New York it was a 3-week event. Do we have any information here locally how long this surge will last? How long it will take to run its course?
Yeah. So I think the short answer is we don't know. You know, there's some other data that says, you know, it may push out, you know, into October with hospitalizations. So I think we just don't know yet what that's going to look like, because there's a lot of moving factors. You know, you have to remember, this Delta variant is much more contagious than the virus that we saw in March and April of last year. So the UK variant was about 50 to 55% more contagious from the initial coronavirus. This is now, you know, 50% more contagious than that, which is why I think we are very quickly seeing very large numbers of positive patients, large numbers of just cases in the community, and we're seeing some of those breakthrough cases of the vaccinated individuals who are testing positive. Now, the good news is the people who are testing positive who have been vaccinated tend to do just fine. They're at home, they have minimal to no symptoms, and they do okay, and they get past this, and they don't end up in the hospital, which is what we saw previously. And those that are unvaccinated, we're seeing the younger people in the hospital, which is very unfortunate. And so I think we have to look at, right now the community is really on fire with virus, right? It's all over the place. And which is why we have to do some of these measures that we talked about, why we have to get more people vaccinated. And I think now it's just time to let the community know that it's out there, right? We know how to get past this. We can do it. We have done it before. But we don't know yet when we're going to peak in our hospitals, when we're going to peak in total positivity, which is why we're talking about all this stuff now, early in this, so that we can try to, tamp this down as fast as we can.
What's your message to people I've encountered who said, I had COVID in 2020, why shouldn't they take that as an insurance policy that they couldn't be infected again if they are not vaccinated?
That's a very good question. To what Dr. Elder said, people need to understand that this Delta virus is a fundamentally different virus than the original Wuhan virus that actually was, or even, prior to that, the Alpha variant, that preceded the Delta variant. My question is, the answer to this question specifically is that if you were originally infected, last year, you actually do develop some immunity. But the immunity that you developed was to the Wuhan or the original strain or whatever strain that was active at that particular time. So the issue is that natural immunity diminishes over time. And so we're in a situation now where, from an epidemiological perspective, it's completely different. It's a new virus. To Dr. Elder's point, it said it's be almost 225% more contagious and transmissible than the original Wuhan strain. And in addition to that, the viral load is about 1,000 times more. So the likelihood of this breakthrough cases that he related to, the reason why that actually happens is you're in a situation where you have a highly transmissible disease, you have a high transmission rate, and then you have people who may have already been vaccinated or have natural immunity that are constantly come into contact with a large group of people who are unvaccinated and who actually are carriers of the Delta variant. And so that's why the issue with the breakthrough cases actually has become an issue. So my recommendation to them would be absolutely, you need to get vaccinated, even if you actually had previously gotten COVID and actually recovered.
I have a question. Are we saying that we're less contagious if we're vaccinated? Has there any study to that?
Yes.
Yeah, so there is some early data on, are vaccinated individuals, do they transmit less virus, or do they even transmit virus if they are, fully vaccinated and then ultimately come in contact and test positive for COVID? We think they may be less, they may be shedding less virus. However, this is, again, a moving target, right? So now we have this Delta variant, there are new things happening. There may be some transmission actually between vaccinated individuals, which is why we're saying everybody mask up. But that's very early, so it's very tough to say. So unfortunately, we don't have a great answer for it. We do think the vaccine does protect people from those higher viral loads, which could translate into being sicker, and from transmitting. However, at this point, we're so early in this data that we just have to tell everybody to mask up just to mitigate that issue. And to decrease transmission in the community.
Will the minors be able to get tested at these testing sites? Will minors be
12 and up, right?
No, testing. You asking for testing or
Oh,
vaccination?
testing for COVID testing? Like if
Yeah.
they're getting sick and they don't know if it's the flu
Yeah,
or
what's the
COVID,
testing?
will they be able to walk out just like the adults did? Because before, minors were not allowed to get
Hmm.
COVID testing.
Huh? Is that right?
Yeah, depends upon the site, but some are
Yeah.
doing 5 and up.
Yeah, some sites are doing 5 and up. I'll get that question answered for you. One of the discussions, I'll ask, we had this discussion there. Some people are sick and, or maybe feeling exposed, and they want to go get tested, and then that's the time where they think, let me get vaccinated. So I want one of the medical professionals to discuss, when can you get vaccinated if you have symptoms or if you're feeling sick? Can you, because some of our sites are having both, so I want to clear to the public when you can do, or if you can't, so if you can.
Well, look, I mean, if somebody's having symptoms and feels ill, gets tested and is negative, I'm not sure that's the right time to get any vaccine. So my personal opinion would be, if you're having symptoms, it's not the time to get vaccinated. And certainly, if you get vaccinated, and I'll remind everybody of this, since we're on the vaccine, remember, it takes weeks. I mean, with the old historic flu shot, it used to take 10 to 14 days before you would be considered immune to, or vaccinated, excuse me, not even, vaccinated from the flu that year. But with the COVID vaccine, as you all know, most of the vaccines out there take 2 injections. And it's not until probably a week or 10 days after the second injection that you are substantially vaccinated. Now, you get some vaccine effect, soon after, but keep in mind, it takes a little while to get vaccinated. So that's why, it's even more of the reason that we're pushing the other measures, the masking and the social distancing.
Yeah, that's an excellent point. If I could just add to that. Excellent point. It really, in terms of when we talk about fully vaccinated, to the point that Dr. Stephanovich made, you have to understand, fully vaccinated actually means that if it's a 2-dose vaccine, it's actually 2 weeks after that second dose. And so if you take a vaccine, for example, like the Pfizer, which is a 3-week vaccine, so it really, if you look about the total length of time, it's actually 2 weeks after that second dose. And so that's essentially 5 weeks before you're actually fully vaccinated. And one of the studies that actually has come out to kind of reemphasize the importance of getting both doses is that 1 dose of the vaccine is really only about 30% as effective as 2 doses. And so if you've only had 1 dose, definitely make sure that you abide to all the measures during that time until you actually are fully vaccinated, which is, again, 2 weeks after the second dose of a 2-dose vaccine or 2 weeks after a single dose.
This would be for Dr. Ward or Dr. Elder. I mean, it sounds like in your medical opinion, when school starts back up, you would advise parents to have their kids wearing masks regardless of vaccine status. Is that accurate?
Yeah, I think the easy answer right now is unvaccinated kids like 12 and under. So for me, I have 2 young kids, they're 8 and 10, can't get vaccinated yet. They're gonna be wearing masks. The question is there about, should unvaccinated people, vaccinated people be wearing masks as well? I think that's something that the CDC is looking at. I think right now, as of today, where we are, we should all be masking because there's so much virus in the community. If we can get that down, I think we can alter what we do and relax some more because we get the overall viral, the pressure of the transmission in the community gets pushed down. And so we're in a much better place like we were, earlier this year. But we're just not there yet. I hope that by the school year, we can be there.
I'll add to that. I sure hope that, that we get over this spike soon, because you do want to, I hate to say the word reward, but reward the children who have been vaccinated. So I would hope that this spike is down. I'd like to see my kids not have to wear masks at school. Okay, they're, not only have they had COVID, they've also been vaccinated. So, I mean, I'd love to see them, set an example for their classmates, by being able to say, I don't have to wear a mask because I am vaccinated.
Just one question to some certain individuals have said the effectiveness of certain masks, that certain masks are ineffective versus the N95. Is there any truth to any of that?
Yeah, I mean, just when we talk about the masks in general, you have to remember the different masks are for different things. So an N95 really protects, the wearer, right? So it's a filter, it's a respirator face piece where, for example, we use them in the hospital when we're caring for COVID patients, and we're doing things like, putting in breathing tubes, or they're getting nebulized treatment that's in the room. Those are filters that help protect the wearer, right? So that protects particles from getting to you. The masks that we're all wearing in here typically are masks that protect kind of both sides, right? The person who is ill is less likely to transmit virus through the mask into the room, get other people sick. The person now that we know now that is wearing the mask actually gets protection as well, who's not ill, because again, less likely that particles and things will get to that person in high enough quantities to get them ill. So I think the big thing to remember, and the CDC has actually really good infographics on this on their website, is, obviously, hospital masks like this work well, and then cloth mask with multiple layers is really what we're talking about. So if you have a very thin, one layer, some of the gaiters and things that were just one layer don't work as well, and so you want multiple layers of cloth if you're wearing a cloth mask. And the other thing I want to remind people about too is you'll see some masks with the little filter on the side, the exhalation port. You really shouldn't be wearing those either, because that allows you to exhale more easily, it allows things to get out. And so you really probably shouldn't be wearing those either. You should just be wearing just a regular face mask with no exhalation ports.
Right, and I'll add to that, the mask that all of us are wearing up here, they're really, like you said, like Dr. Erler said, to decrease you infecting somebody else, and it's done by the fact that the velocity of the air coming out of your mouth is decreased when you have a mask on. As if, I guess if you held a candle in front of yourself and tried to blow it out with a mask on, that's the best example you can use. So the person who is infected with COVID, when they're wearing a mask, most of their virus is kind of staying here instead of out there.
Any other questions? Okay, good. Thank you. Thank you so much for being here. Thank you.
I need to talk to you.
Huh?
I need to talk to you at some point when this is all done and over. We're taking a trip next month to Baton Rouge. They have a mental health drop-in center.
Okay.
They got they passed a millage to have a mental health drop-in center that is apparently